Welcome everyone to our January First Friday Free CME series. Today we have Dr. Patricia Gibson. She is a physician who is board certified in psychiatry, addiction medicine, and anesthesiology. She's co-founder and chief medical officer of the nonprofit ABHIN, the Arkansas Behavioral Health Integration Network, whose purpose is to create professional collaboration and network opportunities for training and support for the implementation of behavioral health integration in the medical setting in Arkansas. Behavioral health integration is an ideal expression of Dr. Gibson's passion for working in interdisciplinary teams and transforming healthcare to focus on healing of the whole person. She's been actively involved in integrated behavioral health and value-based population health for more than 10 years, including work with the Baptist Arkansas Health Group BHI team and the Arkansas VA system. Her other passion is education, and she is joining the core faculty at Baptist JAMA Psychiatry residency program, and hopefully will also be working with family medicine residents and staff. So we may be seeing more of her soon, I hope. So Dr. Gibson, feel free to take it away when you're ready. I'm frozen. You may have to stay off because it froze again.
Forward to this conversation because of all the events that have been happening in our news lately. And I think that the things that apply to cope that I'll be talking about with COVID-19 will also apply to general coping with the various stressors that are going on. Just over the holidays, so I did take 10 days off and did not check email. I'm working on my own burnout prevention strategy to be able to deal with all that's going on, but as well as just my routine as a physician and as a wife and a mother and a society member. There's just so much going on. And so I've been really trying to be intentional. And one of the things that over the holiday, one thing that I love doing is puzzles. And so this year when my husband said, "What do you want for Christmas?" I did say puzzles, and I ended up with getting 6 or 8 puzzles, and actually was able to get 5 of them done over the holidays. And I think this really applies to what we'll be talking about today. And in these puzzles, you'll see the one of the horses, it's only 500 pieces, and the one of the dogs is 1,000 pieces. And I find myself, I'll do puzzles while I'm watching football games and movies and things with my family. So they're fun, but also it's a good problem-solving activity. And so the way I normally do them will be to put the edges of the puzzle together and go from there, and the colors and the things that are in them really matter to me. The 2 small ones are actually wooden and little pieces that are animals, so they were pretty fun. Now this round puzzle, I've never done a round puzzle. And so this is the one. It was pretty challenging, 1,000 pieces. And I started it doing like I normally do, working around the edge. And I found that it was very challenging to do it in that way. And I had to change the way that I approach solving this problem. And I think that's something we need to think about as we are trying to take care of patients, but take care of ourselves and our families in this time, that what we've normally done to solve issues, solve problems, we need to think about new ways of doing it. So in this round puzzle, it took me a little bit, but I figured out it would be better to start at the middle than doing the outsides first. And then it became a really fun activity to do. The other reason I want to show this slide was just, this slide really bugs me, the fact that it is not perfect. It is not even, and it is, it just doesn't, I don't like the way that it looks for myself personally. But one of the things that I'm working on for myself is that perfection is the enemy of good. And I think that is an important thing for us to think about as we're trying to take care of people and ourselves, is that We can't do all of this and everything for everyone to the maximum amount that we need, so that we need to deal with our own perfection seeking. Today, I hope to give you maybe one piece of the puzzle. I always think, well, let me give everyone all that they need. And so my goal for today is to give you a piece of the puzzle. You will be putting together your own puzzle and applying this to your own life and your own practice and taking care of your patients. I wanted to be sure that you are aware of, I'm not of my disclosures. I am employed part-time by Baptist and work with the behavioral health integration team in the primary care clinics. I also am just starting with the Baptist UAMS medical education program, and I'll hopefully get to work with the residents there as well as we get our psychiatry residency program going. ABIN, Arkansas Behavioral Health Integration Network, that's actually how Mary Beth and I ended up meeting. This is an organization I'm a co-founder of, and we are trying to promote behavioral health integration into medical settings like family practice, primary care, pediatrics, OB. Also wanted to be sure that you knew that I'm on the medical advisory committee with Qual Choice and Centene. So I have various areas that I get influenced by and hopefully learn a lot from and hopefully can add to. This presentation, being it's a CMA presentation, I want to be sure that you do have some good objectives. And what we were hoping to do is to look at the effect of the COVID pandemic on mental health, to look at the possible effect in your own practices, in your own families and ourselves, and then some to look at a plan of action. The thing that I really want you to take away from this talk, though, is three things. One, that the fact that the brain is an organ. And that seems pretty obvious, but there's a split between the head and the body. And although family practice physicians are better than any physicians as far as taking care of the whole body and the whole person, we often forget that the brain although it's a mystical, philosophical, difficult to understand organ, it is an organ, and it is affected by all the diseases and disorders that other organs of the body are affected by. And the autonomic nervous system is a huge piece of how the brain is affected, but it's a huge piece of what's happening in mental health these days as we're coping with the COVID pandemic, as well as the national news. If you only remember one thing from this hour conversation, is to put the oxygen on yourself first. And that doesn't matter whether you're the physician, whether you're working in a clinic, whether you're in your home, in your family, you can't help anyone if you don't put the oxygen on your face first. So that would be the single thing I hope that you take away from today. So COVID and mental health, it's everywhere. I've gotten so saturated by just can we even just read anything without being overwhelmed with all the information of COVID. At first I was trying to keep up with it all, but it'd get overwhelmed. These slides are actually from yesterday, that the Arkansas Medical Society gives an email every day and has great stuff on the website. The blue in the middle is actually from the Little Rock website. So every website, everywhere you go, there's always going to be a little flag so that you're constantly reminded about COVID, but also there's a lot of resources if you want to look there. At times, though, it's a little bit overwhelming and is more like a 100,000 piece puzzle of how do we figure out which pieces that we need to know. One of the really relevant things, the American Psychiatric Association has free courses every month, and that could be for any physician. And the one that they're offering for January is on the effects of loneliness. I think it's interesting that we haven't usually thought of loneliness as a mental health or a medical issue, but you can see now that it's the course that's being put on by the American Psychiatric Association. So that's a resource for you, but also something to be paying attention to is the effect of loneliness. So last night I closed my computer. I was all ready to do this presentation and just looked at my email one more time. So there's one more issue, the JAMA Psychiatry issue that came out yesterday. There's an article there. And so I had to fight I need to read this and be sure to tell you guys what is the latest about the mental health current risks and recommended actions, but I can't keep up with it. And I don't think any of us can keep up with it. And that's something that we have to figure out, is that what can we do? What can we do for ourselves, for our patients, our practices, and our families? It's everywhere. Scientific American even says the surprising mental toll of COVID, and looking at the rise of depression, anxiety, that it's a whole lot worse than was expected, especially among the young. And that's something to be paying attention to. This was the December 1, 2020 Scientific American online. CNN, January 4th, mental health is one of the biggest pandemic issues that we'll face in 2021. So this is something that we can't get away from, is the mental health effect of the pandemic. Now, this is the CDC Household Pulse Survey from November 25th, December 7th. I would imagine that if this survey is done, the next time it's done, whether it's done quarterly, monthly, that it will be a little bit different. But if you notice that Arkansas, we're often in the middle, but we're in that green of the 41 to 43% of people who are reporting symptoms of anxiety or depressive disorder. And so we're not just saying feeling anxious or sad, but also having to the level of a disorder. That's 40%. Some of that data is substantiated by this. This came out in the summer. This is the CDC M&M weekly report from a survey, and they published it in August, but it was done in June. The yellow highlights are all of the respondents. The green are the South. So if we go through each of these, you'll see that 25% of the people reported symptoms of an anxiety disorder, but in the South, it was 27.9. Depressive disorder, 24%, higher again in the South, 26%. Having either anxiety or depression, 30% of the people are reporting, and this was back in the summer, anxiety or depression. And then they reported related trauma, stress related disorder symptoms that were triggered or caused by COVID. 26% of all people, and almost 30% of the people in the South are reporting trauma related symptoms. Pretty significant too, the next column, that 13% of people either started or increased substance abuse, alcohol or drugs that's prescribed or illicit, to cope with this stress or emotions. But it was 15% in the South. That's not people who are having an addiction necessarily, but people that are using alcohol and substances to cope. This in red, really significant, that in the past 30 days, 10% of people admitted they had seriously considered suicide. And in the South, it was 12%. This is really significant. This is not, I'm having thoughts that I don't like my life. This is having thoughts that I want to end my life. And then the last column, this is probably where the map we looked at, that 40% of the people are reporting at least one adverse mental or behavioral health symptoms related to the pandemic. This is the slide that is from that same data, but it's talking about the suicidal ideation among young adults. And although generally there is significant suicide in young adult population, you'll see in 2018, it was 4.3% of adults had seriously considered suicide. But at this time in June, that was 2.5 times higher, of 10.7% of the people seriously considering suicide in the age range of 18 to 44. If you look at 1 out of every 5 people from 18 to 44 had considered suicide. So this is pretty significant, and it's significant that it may not be a population we would normally look at. It may, they may or may not come to the doctor, but an important thing to know is that of those who complete suicide, the statistics are somewhere between 30 to 40% of those were seen by their family physician in the 30 days prior. So this is something to have a heightened awareness that people really may be considering suicide, triggering it during this time, not knowing what might be triggering it. This was same data back in July, looking at percent of adults over age 65 who were just reporting that the stress related to the coronavirus was having a negative impact on their mental health. And you can see it was almost up to 50% back in July. These data, as we said, may be very different now as the year is going into and where the pandemic is continuing, but also with all of the things happening in our country. This is confusing a little bit, but worth looking at. This is the mental health related emergency department visits in children less than 18. And it's between January and October. So in the top, the solid line is the emergency room visits in 2019. And as they fluctuated week to week, the dotted line is 2020. And so what you can see that mid-year, the overall visits went down once the pandemic started, and then they gradually were increasing over time. There's still fewer visits to the emergency room by children, at least up to October. But the thing that's concerning is it's a proportion of the visits that were related to mental health issues. Again, the solid line is 2019, 2020 is this year. And you can see that across the board, there's been an increasing percentage of the ER visits for children less than 18 are related to mental health. So you can see this issue is affecting our folks over 65, young people 18 to 44, and then the kids. So it is affecting everybody. And although that might seem kind of obvious, it is showing up in the statistics. It's also a global issue. This is United Nations, their policy brief in May, and they were talking about the need for action on mental health. And you guys are probably better than I at knowing the whole effect on the body, but talking about the brain health is that COVID-19 is causing neurologic manifestations of headache, the impaired sense of smell, agitation, delirium, stroke, and encephalitis. So as you're assessing patients with confusion or they're just not right, pay attention to delirium actually could be related to COVID-19. A lot of the underlying neurologic conditions are increasing the risk for hospitalization, and then paying attention to just stress, social isolation, and violence also are affecting brain health in everyone in the family. The social isolation and the lack of physical activity and reduced stimulation may progress the cognitive decline of your older patients. This is a really impactful news that December 30th, 2020, the National Institute of Neurologic Disorders and Stroke, this is a picture of a biopsy of a deceased patient who from COVID-19, and what they saw was blood vessel damage and inflammation. They were surprised. They were expecting the brain damage was related to lack of oxygen, but it was multifocal areas similar to strokes and neuroinflammatory disease. Initially, when I was going to say 3 words I wanted you to remember from this, one of them was going to be inflammation. Inflammation is going to be happening in the brain, and throughout the body. Even before COVID, we began to realize that depression is not just a neurotransmitter issue, but it is an inflammation in the brain. So the brain is an organ. It is affected by inflammation, and that is a part of what is causing symptoms, not only from COVID-19, but also your patients who may have inflammation in their body causing heart disease, diabetes, all the other inflammatory responses, that it is also going to be affecting the brain. So every patient you might want to consider, are they having any mental, emotional, or psychological issues? And certainly we're seeing this with the COVID infection. And then you add that with the situations that people are having to deal with the pandemic. So this is kind of how I feel as I listen to all this, the puzzle. This is not how I put it together, but it's how I was taking it apart. And when you see your patients or your family or your situation, it can be pieces of us are missing. And how do we get those pieces together? One of the issues that's coming up with COVID-19 is the fact that it's disrupting our mental health services. That's around the world, but it's also in the United States. And you all know that there's just a lack of mental health resources for people who are having issues. This was pre-COVID, 2018. And the green is actually better. The orange is not as good. And what it's showing is what rate of mental illness a state has compared with their access to care. So the green states have lower mental illness and more access to care, whereas the orange have higher mental illness and less access to care. And again, Arkansas is in the middle, that we do have a significant amount of mental illness and less access to care. And the COVID pandemic is only making that worse because of straining the system of the number of people that are having mental health and emotional issues, and then the affecting inability to get access to care. So unfortunately, the people who are going to see most of the patients who have mental illness, mental disorders, stress, anxiety, depression, substance misuse, suicide, overdoses, are you guys in family medicine. And I know you know this better than I do and could give this lecture, but it's an important thing for us to be paying attention, because you can get overwhelmed with all the physical illnesses people have. This slide's important, not just about COVID and pandemic, but it definitely applies now, is that what we see is the tip of the iceberg. And oftentimes as physicians, we're trying to solve that, what the symptoms that we see or what is in the lab. And it's important to look at what's underneath that. It's more obvious right now, but sometimes we forget that when somebody's presenting to the clinic with sleep problems, issues with pain, issues with their digestion, their diabetes out of control, you want to figure out what else is going on. Obvious in social situations, you ask someone, well, how's your family? What's happening? Are you able to get out? Are you able to get what you need? But sometimes in clinics or medical settings, we really cone down to specific measurable labs and that type of thing. But it's important to look at how all these situations are contributing to the symptoms that are showing up that patients may not realize. Their stomach issues, their pain is related to their living situations or social situations, what's happening with their kids, what's happening with their kids going to school, worrying about what's happening with our country. So this is a good news, bad news slide. One is it's really important that physicians know people look to you for answers. Before the pandemic, the trust was very high, almost 80%. Perhaps a little bit of bad news is now people aren't sure who to trust. And trust is a huge issue in we could spend a whole hour just on this. But the thing to take away is kind of what I said, we cannot fix everybody and everything. People that your patients that you have relationships with, they are trusting you, they're looking to you. It can be pretty overwhelming, but I think about what Mother Teresa said, and I'm not Mother Teresa, but she was trying to deal with poverty and hunger. And somebody said, why do you think you can do anything? You know, the poverty is so great. The problem is so huge. And what she said is, I got this baby to take a bite. So what she would do is focus on the baby in front of her, the person in front of her, the problem in front of her. And so that's what I want to try to do for myself, but want to encourage you to know that you can't solve this whole situation. You can't even be the best and most perfect doctor, most best and most perfect person, but just take care of the one in front of you. And the one in front of you may be your patient, your staff member, your family member. But you do have credibility. And whenever a physician tells a patient to do something, there's been some good research in the past that if a physician tells someone, this is normal, we know you're feeling stressed, we know that you're having trouble sleeping, of course you are, that's normal reaction to what's going on. So this is the coping after disaster. What is normal in your coping with the disaster? And actually this slide was in coping with the disaster of COVID-19. I think that it's all the more relevant as people are feeling unnerved and upset about the things that are happening in our country. But the thing to pay attention to, these common reactions in adults after disaster, if you read through them, they're actually a lot of the same criteria of major depressive disorder. Problems with sleep, feeling sad, depressed, but also irritable, anger, real hyper. Some people feel no feelings. They feel numb. They feel exhausted, no energy. They have trouble concentrating. They may not have an appetite, or they may eat all the time. They may isolate themselves more, intentionally avoiding and not doing things. They may think that no one else feels the same way that they do. A lot of headaches, stomach aches, pain, misusing substances. These are normal reactions to any disaster. They also could be symptoms of major depressive disorder. So telling your patients, so you're having this pain, definitely you're going to have to look for what else could be going on, but pay attention to this. Could be the tip of the iceberg. It's a normal reaction to disaster and trauma and stress. I know this slide is a little bit blurry, but I wanted you to see the autonomic nervous system is like a seesaw. It's very connected, the parasympathetic with the sympathetic. And any person that you see, and including ourselves, we're going to be at some balance of how much sympathetic activity do we have versus parasympathetic activity. One of the things, ACEs, adverse childhood experiences, before all this happened, we were becoming more aware of trauma that people had experienced in childhood may be affecting them as adults. And we were trying to decide, should we be screening everyone for ACEs? Because childhood trauma affects adults and may cause physical illness, mental illness. We were trying to pay attention to that. And now we really need to pay attention to that trauma is going to affect people. And the way that our bodies react is with our autonomic nervous system, and rest, heal, and digest versus fight or flight. This is just wanting us to pay attention to the autonomic nervous system affects every organ. That brain is an organ. And then every organ is going to have some influence, whether you're in the sympathetic fight, flight, or freeze, or in the rest, nest, and digest. Another way of saying that is feed, breed, and rest. That if people are sympathetically aroused, if they're afraid, if they're stressed, if they're anxious, if they're worried, what happens is this sympathetic outflow. And what they're going to do, unfortunately, if they come to my office, they're complaining of mental health issues. They come to your office, they may be complaining of dizziness, heart racing, their physical issues. Whatever physical disorder they have, it may be worse. And think about the sympathetic effect on all of these systems. And that the solution is to tip the seesaw back in the other direction by increasing parasympathetic tone. That's where we can get some recovery. But all of us are at some balance of these, and every patient that you see, their symptoms are going to be better or worse or somewhat even relieved just using increasing parasympathetic tone. So what is a solution? The piece of the puzzle that I can offer you today is medication. Actually, it's not. There might be times that you are going to have a happy pill or medication that people need for mental health disorders. You want to look at how severe is the disorder and how are they functioning, but keep in context all that we've been talking about, that every person who presents with complaints of depression, stress, anxiety does not need medication. It certainly might be something that you use, but also giving other advice that pays attention to their sympathetic nervous system is perhaps more effective, but certainly as effective, and in the long range is going to be something that they need. So don't feel compelled to treat every complaint with a prescription. I know when I did my family medicine rotation as a student many years ago, I was mentored that patients think you're not helping them if you don't give them a shot or a pill. If they don't leave with a prescription, they think their doctor hasn't helped them. But pay attention to how else you can help them by letting them know what they're going through is normal and that there's other things for them to do other than just take a pill. And I just have to say that if people are coming in and complaining of anxiety and we want to reach for medication, be very cautious about prescribing benzodiazepines. We often will say, well, this really is a bad situation. I'm going to give them Xanax for the short term. This really can be setting people up to more of a problem. And so just be cautious. It's not that you never want to use them, but it's a time to be cautious about using them because people may have a hard time getting off. A really fun, good book, Why Zebras Don't Get Ulcers. This is an excellent book. I've listened to it as an audio book. It's useful for, physicians, staff, lay people. It's written by a biologist, I believe, but he does a great job of describing the effect of stress on the autonomic nervous system. So this is the one takeaway slide to really focus on. So what to do? What's the piece of the puzzle? Remember, you can't help pour from an empty cup. So you've got to take care of yourself. And that's whether you are the physician, the residents, the staff, the parents, the family members, the whoever. We've got to take care of ourselves. And definitely the medical care, but also paying attention to the basic things. These are really basic that we need to get back to. That getting plenty of sleep, nutrition, what you're eating, having enough activity, social activity, and family, fun, and spiritual meaning in life. These little things are apps that are some of the apps that I've found that are really useful. CBTI Coach, that's Cognitive Behavioral Therapy for Insomnia. That has some really good tools for anyone in terms of being able to relax or looking at ways to help yourself sleep. Yoga Nidra is actually also a type of relaxation. It's you can either Google it and find some audio tapes, or this is an app. And I couldn't tell you all that they say because whenever I listen to it, I fall asleep midway. I'm like, oh, I've fallen asleep. So it is working. But this is a really useful, you can put it on at night and it will help you. PTSD Coach and actually the CBTI Coach and the Breathe to Relax, those are all VA apps. The VA is really good at creating some apps that are available to everyone, but PTSD Coach, some of your patients may be having trauma that's triggering PTSD or developing. And this has some tools, but also help you figure out if they do or not. Of course, the little pedometer and getting your steps in. The Breathe to Relax and Headspace, the way to increase the parasympathetic tone, the fastest way has to do with your breathing and relaxation. I believe Headspace is offering some free memberships for physicians. So that's something to look at. And I think that it is on this AMA website link of Caring for Caregivers. So check that out. Thinking about our own burnout. So the Happy MD is a website that has a lot of good information about physician burnout prevention and how do we keep ourselves healthy and how do we cope, because these are overwhelming times and they're gonna be overwhelming for a while, but we can get better. And like a lot of things, the stress and darkness gives us opportunities for real growth. And so I also can see that there's going to be a lot of good coming out of this. Resources. So remember, put the oxygen on yourself first. The AMA has some good resources for physician burnout and stress. Also, Rick Hansen is a psychologist that has some great resources and talks about neuroplasticity, that actually what we think and what we do actually does change the structure and the function of the brain. And that's how we can overcome a lot of this stress, and your patients as well. Psychological first aid. Now, this is an app, and you can find information on the internet about this is for lay people. It is an evidence-based approach to how to help people cope with stress. So this is something you could share with people, but you can also learn about it and use this in the clinic. Your front desk people, anybody can learn how do you help people who are stressed? So this was developed when people go into disaster zones and this type of thing, but also a lot of the people who show up in our clinics are stressed, even if it's about, they may say it's about their appointment or their lab work or waiting, but remember that the stress that they're having is on top of all the stress that they're dealing with out in the world. So psychological first aid are some really lay people tools, but that all of us can use. So great app, great information. This is just reminding you that there are some suicide prevention, there's hotlines, there's resources. Our website, abennetwork.org, we have a couple of very good webinars. Dr. Kent Corso gave some good information on how do you do assessment and treatment of suicide in primary care. He approaches it that in primary care, anybody in your clinic knows what to do if someone walks up with chest pain or they look like they may have a stroke. So suicide should be the same way. It shouldn't be an event that stops the whole clinic and takes a physician 2 hours to deal with it. There are ways to do with it and figure out, is this someone within about 10 minutes, you can figure out, do we need to go ahead and get them admitted? Or are there some things that we can do with them as an outpatient? So that's a talk for another day, but you can find it on our website, abennetwork.org. Here's some general resources for the public and your family, for your patients. Like I said at the very beginning, there's so much information. We're just drowning in it. But here are some that I would say are reliable and some good resources that you can refer and use. This is another resource that has to do with behavioral health integration into primary care practices. I mentioned that there's just a lack of mental health resources. And although I've been doing behavioral health integration for 10 years, starting with the VA, and I know you guys at the Family Medicine Clinic, resident clinic are using behavioral health integration. This is a resource, the American Medical Association and 7 of the big organizations, including the Academy of Family Physicians, has supported this development of helping practices learn how to do behavioral health integration, and they've created a toolkit. This is just a list of resources and references of some of the slides and things that I have. I didn't go into much detail on ACEs and ACEs Aware, but that is another place that you can look at resources that have to do with trauma and how we can cope with this situation. Once I got this puzzle together for myself, I really enjoy looking at it, and it just makes me feel like myself. I my whole self, my body, mind, spirit, thoughts, emotions. And I hope that I can provide this type of healing to my patients, but also my colleagues, my family. And so I hope that you can find the pieces that you need as you're looking at your patients and solving the problems, but also for your own self, your family, and everybody that you're coming in contact with. So that's all that I have planned for today. And I'm happy to continue some discussion or answer any questions if there is any, or give y'all time to get on with your next activities. So thank you for the opportunity of being here today.
So I don't know if Dr. Cleveland and his residents can hear us, but if they have any questions, they can pop in. I do have a question. I missed a stat towards the beginning of your presentation where you said 30, and I might have it wrong, 30% of suicides had seen a family practitioner at least 30 days before. Was that suicide attempts, or say that again if you have it?
Well, I'm not going to give you the exact. I'm not a good Trivial Pursuit person, but I would say at least 30% completed suicides.
Okay, that was completed.
But if you want me to get you a statistic on that, because that is probably pretty relevant, I can do that.
I just wanted to use it for a Facebook post to, or that's our e-blast. So yeah.
That's why I want to send you the exact one. Okay. So I'll get it for you. Well, I hope it's been helpful, and wish you all a continued success in your in the new year and as we get going. And I look forward to talking with you again.
This was fantastic. Thank you so much.
Thank you.
Thank you.